And good evening, and thank you for joining us. My name is Ryan Burrows, Executive Director of the American Kratom Association. We called this meeting tonight to bring you up to speed and formally announce the filing of the Federal Kratom Consumer Protection Act. We have a robust plan ahead of us, and no one better than Mac Haddo, our Senior Fellow on Public Policy, to guide us through it. The Q&A is open, and I will now turn it over to Mac for the latest.
Thank you, Ryan, and welcome to everyone joining us this evening. Thank you. Obviously, the filing of the Federal Kratom Consumer Protection Act is a very important milestone. We saw at the end of the last congressional session that Senator Mike Lee and Senator Cory Booker of New Jersey and Congressman Pocan had filed the federal bill in order to initiate this discussion. And it did. We have had multiple conversations, both with friend and foe, about this, the foe principally being the FDA. But at the end of the day, after evaluating all of the input, the sponsors have remained resolute in the importance of this language. And so we're going to talk about that a little in just a couple of minutes here in terms of what the bill does and what it does not do, and discussion about how you can help. We are scheduling training for all of the advocates to help them in the outreach to their members of Congress. We want to make it as efficient as possible for you to communicate with your congressional delegation to encourage them to become co-sponsors of this important legislation, and to how you can most effectively communicate your personal story about Kratom. We're not asking you to be a policy expert or even to know all of the details of the bill, but merely to share with your congressional representatives your personal experience with Kratom. And I would encourage everyone to look in your email boxes. You're going to get some emails over the next day or so with registration links that allow you to sign up for these training sessions so that you can take advantage of the systems that we have in place in order to connect you with your congressional delegation. As we start this journey, and it is this important milestone, we have to recognize that we essentially have three buckets of enemies that we have to contend with. One, obviously, is the Food and Drug Administration. The reason that the FDA has such a low public opinion rating today is because they have been wrong on multiple occasions about very important public health issues. And the trust that the American public has in the FDA is at an all-time low. And frankly, they have earned that. Even a report that was commissioned by the FDA itself from the Reagan-Udall Foundation demonstrated that the FDA has not been an effective communicator, and that they have been the purveyors of disinformation about a variety of public health issues, and Kratom is no exception to that. We have to recognize that the FDA has this powerful bully pulpit that they work from, and that we have to counter it with the truth. And your personal experiences as Kratom consumers are obviously important. The second bucket of opponents are trial attorneys. And I've got to tell you that every one of the jokes that we hear about, ambulance chasers, and in this case, I'll call them casket chasers, because that's what they're doing. They really have misplaced the priority about finding the truth, because what they do is seduce families that have had tragedies in their lives. And they try to point out the blame and assess the blame solely to Kratom, and against the fact that there is no known toxic level of Kratom that's been established by science, and all of the evidence that's been gathered in terms of science to date points to Kratom being a relatively safe product as long as it's not adulterated and as long as it's used responsibly. We know that people who want to and who regularly abuse substances can harm themselves. That can happen with virtually anything. The absurd extreme of that is that there are many cases of people who have died from ingesting water too quickly and in such a high volume that it upsets the electrolytes and they end up dying. So that just points out the fact that depending on how you responsibly use anything dictates the outcomes that come along. But we know that these trial attorneys are trying to find a pocket to pick. That's all they're about. And they mislead these families to think, hey, just sign up with us. And we've seen these outrageous advertisements that are circulating on the internet where they're actually out recruiting clients, and they're saying, well, let's blame Kratom. And they don't really pay much attention to the facts in autopsies or talk screens. Every death, every single one is tragic, and every family has to deal with it, but they deserve to know the actual truth about what caused the death of that loved one. And sometimes it's not what they think. Sometimes it's underlying health conditions for which they had no relationship whatever to any of the products that their loved one may have been taking. And then, of course, there are issues where people are taking products that do cause their deaths. And I'll tell you, from looking at the landscape here, there are Kratom products get implicated in deaths appropriately because they are adulterated. And probably the best example of all is the case that was heard without any opposition. The vendor did not show up to contest it. And therefore, because of that, we saw this $11.5 million award to the family. But there was no adjudication or assessment of what actually caused the death. And we don't know to this day whether the Kratom product that this individual was using actually caused the death. But what we do know is that the advertising around the product that she was using was something that was in clear violation of the Food, Drug, and Cosmetic Act. We know that the advertising, if true, was saying that this was a super potent and enhanced Kratom extract product. And if that's true, then it's an adulterated product. And we don't know what other substances may have been added to that product in order to give it the kind of marketed appeal that was the reason why the advertising was used to encourage people to use this product. And so if it were truly an adulterated product, there will be no trial attorney that will stand up and say, oh, well, we agree that this was an adulterated product. They won't say that. They won't even go after the real culprit here, which is the FDA. Because if the FDA were doing their statutory duty, they would have blocked that product from being on the marketplace at all. They knew about it. They scraped all of the social media, and they are aware of, the FDA is aware of, products that are being sold on the internet today that violate the Food, Drug, and Cosmetic Act with outrageous claims that induce people to purchase these Kratom products. And the only way that those claims can be valid is if those products are adulterated. We at the American Kratom Association have our Truth in Advertising campaign, and we've referred over 70 companies over the last 3 years that we have documented actually violate the Food, Drug, and Cosmetic Act and the requirements for accurate advertising about their products, and they cannot use illegal therapeutic claims, yet these companies do it. And in all 70 of those, there's been no prosecution, even though it violates the law. It is a criminal violation of the law. There have been 3 of those 70 that have been subject to, that we've referred, that have been subject to a warning letter, which is the mildest rebuke, and no backup and no follow-up to determine whether or not the companies have removed those products from the marketplace. We've tested that many of the products that we referred to the FDA over the past 3 years still have advertising that's in violation of federal law. The FDA is the culprit here, and the trial attorneys aren't going to go after the FDA for 2 reasons. One, there's no money there because the FDA can't be sued for this kind of thing. And secondly, they want to point to the FDA and say, well, the FDA says Kratom is bad. And they want that position to be taken. And if the FDA aggressively starts to enforce the law, unfortunately, they're not going to be able to have as many cases that they would like to have, because there would be fewer deaths of products that are adulterated that lead to fatalities. And then there's a third bucket of enemies that we have, and that's the malcontents that are within the Kratom community that absolutely want no regulations. I can tell you that that is the path to destruction. There has got to be regulations. We know that responsibly marketed products need to be manufactured with good manufacturing processes. We know that labeling is an important part of informing consumers so they can make responsible decisions about the way that they use Kratom products. And those in our community that rail, and I use that word for its true meaning, rail against the American Kratom Association, they're wrong. and we should reject them, and we should put them out to pasture. That's equally true on the side of the trial attorneys who are also misleading the public about the actual circumstances around the safety profile of kratom. So as we confront those enemies, as we move forward, I can just say one thing, that even the most ardent opponent of kratom, those that are trying to cash in, and I understand that a family wants to do that, particularly when you've got a trial attorney that's funding it in order to get to a settlement on these things, even they should agree with us that kratom has to be regulated because we know that the science, whether they want to admit it or not, it's obvious that the science does not support that kratom should be banned under the Controlled Substances Act. They should be on our side on this issue, and it is telling that they're not. Because if they were, then we would share a common belief that kratom should not be adulterated, that kratom should be appropriately regulated and labeled in order to allow people to responsibly use these products. So that aside, let me tell you about the Federal Kratom Consumer Protection Act. We know that Congressman Jack Bergman has joined as a primary co-sponsor on the House. Think about that. You have Mark Pocan from Wisconsin, who's recognized as a very progressive liberal member of the House. And you have Jack Bergman, who's a very conservative Republican, who've joined together in order to promote responsible regulations with the FDA. On the Senate side, Senator Mike Lee, Republican of Utah, very conservative member. And you have Senator Cory Booker, who was out of town when the bill was filed, but our understanding is he'll be adding his name as soon as the Senate reconvenes. And that's obvious because he signed on to the previous bill, which is exactly the same, except for the name, the Federal Kratom Consumer Protection Act, which gives more clarity to its purpose. The provisions of this bill are important. And I'm going to speak in part to our critics that say they want no regulations, because that's living in a fantasy world. First off, this bill will call for research transparency by the FDA. It will require that an open forum, a hearing that would be held on the current scientific data and evidence, and that would have to be done very quickly after the enactment of the bill, after 30 days and within 90 days, where leading researchers, the kratom consumer population, the addiction and dependence groups that are associated to evaluate the associated risks associated with metrogene and 7-hydroxymetrogene, evaluations of the causality of deaths, the adverse events if kratom is no longer available, which was highlighted by Assistant Secretary for Health Jawad in 2018 when he withdrew the scheduling recommendation, and he pointed to the public health concern about the inevitability of people having to go from kratom, where it's benefiting them with a far lower safety profile than for other drugs like obviously opioids that have a much higher safety profile. So these are the reality of it, and then they would have to evaluate the potential health benefits. That research transparency will require the FDA to publish those results with the transcripts, and they would have to open a public docket for comments. And those transcripts of those comments and the testimony of this open forum on the current scientific data and evidence will have to be housed on the FDA website. I can't tell you the number of times when I have heard anti-kratom people point to the FDA and say, well, the FDA says, and then fill in the blank, kratom is an opioid, which we know it is not. That's a lie. They will say that the FDA says it is a dangerous substance that for which there is no approved medical use. And stop there for a second. I hear that all the time. If you walk into a dietary supplement store and you look around at the shelves, you will see hundreds of products for which there is no approved medical use, because that's not what dietary supplements are supposed to do. That's not what the laws that govern the approval of products and the marketing of products in the dietary supplement and the botanical supplement space. You can have a pathway in order to get onto the marketplace if you want to use certain claims in order to sell your product, but you don't have to go through a new drug application process to get an approved medical use. And this canard that they throw up, where they say, oh, the FDA has had no medical use, approved medical use for it, is not a rejection of kratom. It's a rejection of common sense, because those that use that argument simply don't understand the way that the dietary supplement industry in the United States works. And today, and if you want to look at what consumers say about this issue, look at the results. It's a $100 billion industry. 80% of the Americans in the United States report that they use dietary supplements and vitamins in order to maintain their health and well-being. That's speaking from a consumer perspective. And if today the FDA were granted the power to repeal the Dietary Supplement Health and Education Act that empowered the growth of this industry and allowed consumers to make intelligent, informed decisions about the use of dietary supplements for their health and well-being, the FDA would repeal it. They hate it. Their bias against dietary and botanical supplements is real. It is unabashed when they talk about it, and the FDA hates these products, and there's a reason for it. One is they have a longstanding bias that the Congress had to, in 1994, when they passed the DSHEA Act, had to tell to the FDA, we're not putting up with this anymore. We're going to allow for consumers to make these choices about these products. And they told the FDA no, but there's also the reality that there's going to be a money issue involved. When the Congress passed the Prescription Drug User Fee Act, it intended that there would be just under 10% of the FDA's drug review budget that would cover additional funding that was needed in order to modernize that system for drug reviews. What has happened today is that more than 70% of the review budgets are covered by user fees. Now, here's the reality. Dietary supplements, homeopathic remedies, Kratom, do not provide a single penny under user fee acts. And so the FDA has their inherent bias. And of course, the big problem, the kahuna in the room is the fact that there is resistance from the drug industry where Kratom is viewed by some companies as a competitor against their prescription medications. And as long as Kratom's sitting there as an alternative for people, there's going to be some resistance in the pharma community to it. That's just the reality of the situation. So being able to require the FDA to publish the public docket of comments and the transcripts of the testimony of leading Kratom researchers in the United States, comments from the Kratom consumer population, and evaluating the current existence of science on Kratom today, which has only gotten stronger since 2018 when Dr. Joie made his stunning rebuke of the FDA, calling it embarrassingly poor evidence and data and a failure to consider the overall public health. The case on the science has gotten better for Kratom, not worse. The bill will also require that there be a Kratom task force that will be appointed, and they will have to report within 90 days to the Congress and to the Secretary of HHS, and then quarterly thereafter, the progress on all Kratom research being funded by the taxpayers of the United States. People ask me, why do you have that in there? Simple reason. In 2021, the FDA announced that they were going to do a dose finding study and a human abuse potential study on Kratom. Now, I applauded that. I thought, finally, we're going to get some rational thinking and good evidence around it, because the way that these kinds of studies are done is that the FDA would shop a request for proposals, and they would invite the leading research-based institutions in America to apply for the opportunity to do this research. However, they put one caveat on it. They said that whoever wins the contract and bids for this research would not be allowed to disclose the results without the specific written approval of the FDA. That is an unprecedented requirement. It never is done. And so all of the leading ethical research institutions in America declined. Johns Hopkins, University of Florida, the whole gamut. None of them were willing to participate in that game where the FDA, if they didn't like the outcome, wouldn't allow them to publish the data. And even Dr. Califf, who came into his position as commissioner after the award of this RFP, said that he would never have allowed that kind of bidding to go forward because it is unethical. That study, by the way, should have taken about a year. Has anyone seen any published results of it? The answer to that is no. The FDA, for whatever reason, has not published that data. It's possible that they're still doing it. We heard rumors that they were struggling to find a competent research-based organization that could do the work because so many of the leading research institutions pulled out. Maybe that delayed them. They also, through their import alert, create a real barrier to getting quality Kratom raw materials that are available for research purposes. That might have delayed them. But whatever the delay, the American taxpayers should know. And this bill will require that that all of the current research would have to be disclosed and then updates given to the Congress quarterly after their initial disclosure. The other requirement in the bill that is important is that it will require for public meetings with experts and stakeholders to take place. And that speaks to your experience with Kratom and your ability to speak loudly on that issue. And that will again be published on the FDA website. They won't be able to say, oh, the FDA is against Kratom. You can look on the website and you can see not only the researchers and the scientists who evaluate Kratom from a clinical and a scientific perspective, but they'll be able to see transcripts of real life experiences that people have with Kratom. And that, of course, is open to everyone. I get it. And those that want to step up and test the validity of their claims that are anti-Kratom, they'll have that opportunity as well. But this bill will require the FDA to publish all of that data. The significant thing that this bill also does, and I hear lots of people in the Kratom community who don't understand it correctly, it will protect Kratom from current regulations, meaning that the FDA will not be allowed to impose requirements on Kratom products that are more restrictive than existing requirements for food, dietary supplements, botanical supplements, and dietary ingredients. This is an important provision because everyone, and it's a fair concern, would be alarmed that the FDA would just simply be able to enact regulations that would be anti-Kratom and make it so restrictive that no Kratom manufacturer could meet them. This provision in this bill requires them that they have to play a straight game with it, and they cannot put more restrictive requirements on Kratom than they do with other food products that are currently there. Another important provision is that the FDA cannot treat Kratom products as an adulterated dietary supplement simply because they have not, that Kratom product has not yet received a new dietary ingredient notification as provided in the DSHEA Act. Now, it's important to understand the context and why this provision is so important. The NDIN process, the new dietary ingredient notification process that was put into effect under the DSHEA Act, was intended to allow for a new dietary ingredient manufacturer to make a structure function claim associated with their product as a dietary supplement. In this case, and it's been rejected by the FDA, and we think improperly so, if a Kratom manufacturer does not seek to make any structure function claim, that's a general thing about it. It makes you feel better. It helps you increase focus. There are a number of sort of squishy language that's associated with a structure function claim that gives you a marketing advantage. But if you are a Kratom manufacturer and you simply want to sell Kratom without any of those structure function claims, the FDA should, under existing law, not be able to interfere with it, but they've chosen to expand their regulatory powers. This will rein them in, and this bill will provide that they can't force a product to go through the NDIN process if the manufacturer elects not to take advantage of structure function claims that would otherwise help them in marketing their products. This is an important provision of the bill. And when you combine that with the publication of all the transcripts, the publication of the scientific evidence and data that's been accumulated that will have to be housed and shown on the FDA website, it is a significant sea change in the discussion about Kratom. The last thing that the bill does, and this is critically important, and then we'll open it up for questions. The FDA will not be allowed to use the import alert authority in order to ban all Kratom products, designating them as adulterated products because they have not gone through the NDIN process, the new dietary ingredient notification. Now think about that. This is what they're doing today. They claim that presumptively all Kratom raw materials are in fact adulterated because they don't have an NDIN registration. The FDA gets to control that. They are the judge, the jury, and the executioner. They get to decide. And then they say, well, the reason you can't bring in Kratom is because it doesn't have an NDIN. This is not what Congress intended. It never should have been done this way. But the FDA is, and I'll emphasize this, abusing their regulatory authority. Now the FDA would be restrained to issue an import alert on Kratom if they can identify a shipment of Kratom from a specific exporter that's contaminated with salmonella, E. coli, or heavy metals. We fully support that. for two reasons. One is it protects the public, and secondly, it provides a pathway which should be available and is available for all other products that are subject to an import alert, where you can appeal it and you can get off the import alert. Until just recently, there's been no pathway to do it because the FDA has established a broad import alert on all kratom raw materials. Just last week, the chief of staff to the president of Indonesia, President Jokowi, and General Muldoko is the chief of staff, whose portfolio of responsibility includes managing all of the farming operations in Indonesia, formally petitioned the FDA to lift the import alert with the commitment that Indonesia will take responsibility for assuring that all kratom exports are run through a gamma radiation program that is approved by the FDA to remove these contaminants, and that they will have an independent lab test those raw materials prior to shipping. They will also commit that they will not allow any kratom to leave Indonesia that hasn't gone through this process. We at the American Kratom Association, in working with the farmers union over there called APORI, will offer to the FDA that we will do a secondary check, spot check, to validate and verify that the testing by the Indonesian government independent lab is actually valid, because we'll come in with an independent lab here upon arrival of the raw materials to assure that they're contaminant free. So we're in the position to try to really help in this process and expose the FDA for their single-minded, biased approach to kratom, that they're using an import alert requirement to enact one thing, a de facto ban on kratom that they cannot achieve with the evidence and data that's required for a substance to be banned under the Controlled Substances Act. And again, I'll repeat what Dr. Joie said, embarrassingly poor evidence and data from the Food and Drug Administration, which statutorily is required to call balls and strikes fairly and equitably, and they fail to do so because of their bias. That's why this legislation is critically important. And as I said earlier, even those who oppose us, who say, oh, kratom, in their view, is somehow potentially dangerous, ought to welcome this kind of statutory authority, because right now it's the Wild West, and we need to bring this marketplace into the realm of responsible regulation that provides adequate labeling that informs consumers about how they can safely use kratom products. That's the goal that we're pushing for, and we are recruiting your help. So again, stay tuned for tomorrow. You'll be receiving emails that invite you to participate in some of the advocacy training programs that will allow you to effectively communicate with your congressional delegation here in Washington, D.C. And in that, you'll tell your story, and that you'll then pass that staffer or member off to us, and we will supplement it with the policy and the scientific information that's going forward. We are grateful to these champions in the Congress who recognize that the FDA has gone off the rails, who see that the very same kinds of behaviors that the FDA is engaging in today in anti-kratom propaganda and disinformation occurred back in 1994, when they were doing the very same thing to dietary supplements and vitamins, when the FDA was saying dietary supplements are poorly formulated and they're killing people. They were right in some cases, because there was no regulation on dietary supplements. But the solution wasn't to ban dietary supplements, it was to regulate them. And today we have this robust industry where people are safely using dietary and botanical supplements. This is a system that works if the FDA would just get out of the way. The FDA is right about many things. They tarnish their image, they destroy their reputation when they go off the rails and they do this kind of thing. And we've talked in the past about specific instances where the FDA has simply overreached, where they've attempted to overregulate, and where they've abused their regulatory authorities granted by Congress for purposes that were never intended for that. So this is a great moment for us. We encourage everyone to participate and join us in this effort, and spread the word as far and wide as you can. As you get an invitation, circulate it to all your family members, because this is the truth about kratom. If you listen to the testimonies that are provided in these public hearings around the country, you hear about experiences that people have with kratom, where kratom is changing the quality of life and actually saving lives of people. And every family member is impacted by that. And they have as much of a stake in making sure that Kratom is legally available and that it is responsibly regulated and that it is adequately labeled in order to protect people that are consuming Kratom products for legitimate purposes. So that's our pitch. We need you to join us and to spread the word as far wide as you can. With that, I'll turn it over to Ryan to kind of float out the questions that have been asked so far.
That's great. Thank you, Mac. And our first question, are there any updates regarding the Florida KCPA's proposed rules from the Department of Agriculture? Also, is there going to be any grace period for businesses in the state to get fully in line with the new rules?
Well, this is a difficult issue because the Department of Agriculture was tasked after the passage of the basic framework of the KCPA in Florida to just provide the regulations for how they would allow for the sale of Kratom products to those 21 and over. Instead, they issued a robust rule that went way too far, and we're in the process of working with the Department of Agriculture now to help them understand that they've gone too far. So I don't have a clear answer yet. We're working with them. The initial reaction we've gotten from the department is that they understand that maybe they claim they've been misunderstood. I don't think there's any question that they actually overreached, but we're going to work with them and we're going to get to the right place on that. And the bottom line is that in January, the legislature will reconvene and our sponsors of the bill are alarmed at the behavior of the Department of Agriculture. So I think you'll see some protective provisions put into the KCPA when it's passed with its full framework in the upcoming session.
That's great. And I hadn't realized that attorneys filing class action lawsuits were so prevalent. How many people and or attorneys are engaged in this egregious practice?
Well, it's work for them. And you just have to look around at Facebook, social media, and television ads. I guess the best example is the water at Camp Lejeune. It gets to the absurd where they're advertising on television, trying to recruit clients in order to build a class which gives them strength to go to a company and hose them, or to, in this case, the government, to hose them for a big settlement. And some of these ads are absurd. If you look at the ads that are circulating around Kratom, they make unsubstantiated, unprovable, and outrageous claims about Kratom where they repeat things that are just rumors. They'll say things like, oh, it causes liver damage based on nothing more than a case report where some doctor says, I had a patient present who was taking Kratom and he died of liver failure. Now, they don't disclose that that person had a lifelong problem with abuse of alcohol, which caused the liver failure. They try to draw connections that are unsubstantiated. And so that's part of the challenge we have, is that these trial attorneys are interested in only one thing, and it has nothing to do with the truth. It has to do with building a case that they can squeeze some sort of a settlement out of, in this case, a Kratom vendor, in order to do it. It's outrageous what they do, but it's the way the system works. And the only way we fight it is with identifying the truth and making sure that any judge or jury, where it gets to that point, sees clearly that they've overreached and that they're just they are the casket chasing attorneys that really should be drummed out of the legal profession. But instead, it's a very robust business, and it's everywhere. You see them advertising for clients. If it were truly the problem that they claim it is, they wouldn't have to advertise. They're advertising because they're trying to drum up business, and unfortunately, they mislead families who struggle they have family members who struggle with various problems. And I'll give you a perfect example. Everyone should go and listen to the testimony that was provided before the Ohio Senate Health Committee. And there you will watch a mother who lost a son. And when it happened, she discovered her son. And when the medical examiner investigator came to her home, to our son's apartment, he observed the decedent and he saw a bag of Kratom products on the nightstand beside his bed. The mother explained that her son had been dealing with a number of mental health issues and addictions throughout his life, and that Kratom had saved his life, and that he had for the last 5 years been clean, and he had been struggling with other problems. And on the week before he died, he complained of chest pains related to a COVID-related issue. He had sought medical help. He died of a heart attack. The investigator said to the mother, right there at the scene of the death, said, we're going to call this a Kratom death. And the mother objected and said, how can you do that? You don't know what you're talking about. And she was so strong in her argument that the investigator said, okay, it will take us 8 to 12 weeks to get the tox screen back, and then we can make an official determination. So for now, we'll make it inconclusive. The next morning at 9 a.m. in the morning, the county coroner called this mother and said, I have seen sufficient evidence that we're going to call this a kratom death. Why? Why? They didn't have the tox screen back. You know, that's just bizarre. They're doing it because the FDA tells them to. And if anybody wants the evidence for that, look at the Bannock County, Idaho coroner that called us and volunteered this information and reported that he had done an autopsy on a young man who had become intoxicated and had taken marijuana and some other drugs, left a bar in the middle of winter, was intoxicated, and he passed out and he died of hypothermia. He had drunk a kratom tea, very low level of kratom in his blood system, and certainly the other factors were far more pervasive. And so the coroner determined the cause of death was hypothermia and related it to the alcohol consumption and the marijuana. The FDA called him and said, by his report, and said, we want you to change that to a kratom death. And he said, why? Had nothing to do with it. Oh no, we saw kratom on the tox screen. We want it because we need to inform the public how dangerous kratom is. And this coroner courageously said, it had nothing to do with his death and I'm not changing it. And they said, well, we're going to talk to your boss. He said, I'm the county's elected coroner. I am the boss. Then they said, well, we want to talk to the medical association, I'm sorry, the Medical Examiners Association in Idaho. He said, no problem. I'll get her on the phone. She's not going to be able to contest what I've said either. And then the FDA hung up. This is what the FDA is doing. And they're manufacturing evidence. And unfortunately, they're almost co-conspirators with the trial attorneys that are out hustling these cases, because it ought to be about the truth and nothing about the case in Ohio and nothing about the case in Idaho speaks to the truth of what a cause of death is. And we see that in other cases have been filed where it's an open question as to what actually was the cause of death. And the fact that a person consumed kratom, they may have consumed any number of other things, and you certainly wouldn't blame those things. They might have drunk a cup of coffee, and you're not blaming that for it, even though from a safety perspective, caffeine is far more dangerous in terms of the number of deaths are associated with it. And there are any number of substances that could obviously implicate in a death, but the cause du jour, as advocated for by an over aggressive FDA, is really misleading people.
Thank you, Mac. And how long can kratom be stored and how should it be stored?
That's a decision that's made by the manufacturer, and you should seek that information from them. I've seen very interesting data that suggests that if it's stored properly, you can keep it for a very, very long time. But that should obviously be something you seek from the manufacturer.
And when is the federal KCPA up for a vote in the House and Senate?
So the process of legislation is that when it's filed, it gets assigned to a committee. We know that it's going to go to the Health, Education, Labor, and Pensions in the Senate. We don't know officially where it's going in the House because they don't have a speaker that makes those assignments. We expect it to go to Energy and Commerce. It will then sit there until we get a number of co-sponsors on it. And the number of co-sponsors will drive the attention by the committee chairman. Then there'll be a hearing and a vote in the committee. Then it goes to the floor of each chamber. So this is probably going to be a year to a year and a half process as we go forward here, as we work through the passage of it. Our target date is sometime before they conclude next year that this bill will become law.
Great. And where can I see the Ohio case testimony?
Well, we have links to it. I assume we can put it up on our website, but you can watch. You can go to the Ohio legislature, look for the Senate Health Committee, and you'll be able to pick it out. But we'll try to circulate the link to it as well.
Glenn, I'll send you my email as well. If you can just reach out, I'll send it to you directly. And for Misty, when is the public comment period?
Well, it commences 30 days after the enactment, and within 30 to 90 days. So that's when it opens up. The bill has to pass first, but that's the official part of it. The comment period that we're interested in is having you comment to your congressional delegation by telling your story. That's the important comment period for right now that we want to move forward on.
As we all have seen, the country is very politically divided right now, agreeing on very little, at least publicly. Do you think it will be hard to get bipartisan support for this bill?
Ryan, that's a great question. No, we already have it. You see, when someone like Mike Lee from Utah and Cory Booker from New Jersey can agree on a piece of legislation of this significance, absolutely, it shows it's bipartisan. Same is true over on the House side with Congressman Pocan from Wisconsin and Congressman Bergman from Michigan. These are polar opposites politically, but they're unified around one thing, and that is to allow the American people to have the freedom to make informed choices about the products they use for their health and well-being. And that's what we're about. And our critics are going to be people that don't understand the potential value, as Nora Volkow, the director of the National Institutes on Drug Abuse, properly says. This is something that we are going to fight in the trenches on in order to get passed. There will be opponents. But it won't be partisan. You're going to have the addiction recovery community that's trumping up some nonsense about how kratom use disorder is somehow significant, and they want to treat kratom use disorder, which by every description is a mild dependency that you can wean off of within a week or 10 days, except for rare cases where you have some psychological issues involved. But typically that's what happens. And they want to treat them with Suboxone and the other two medications that are approved for reimbursement by these addiction recovery centers, by the federal government. That's our problem. And the FDA sits there and says, oh, well, we're concerned that people are sitting at home using kratom to self-medicate. That's what the addiction recovery centers don't like. They want them in their clinics making money. And there is a stigma attached to going to an addiction recovery center, and there is a cost associated with it, which puts it out of reach for many people that desperately need the help. And if Nora Volkow is right, and I think she is, and the science proves she is, then we ought to have this product available for people in that circumstance. And the opponents that want to get in the way of this we need to get them out of the way. And so I think we're going to be very successful when it comes down to an evaluation by people about what's the best policy to help people that are suffering from acute and chronic pain issues that end up addicted. Let's opt for a safe alternative to that, which kratom provides.
Thank you, Mac. And why exactly do we want the FDA to regulate it?
A completely unregulated marketplace kills this industry, because whether we like it or not, there are kratom manufacturers in this business that will push the limit, whatever that limit is. And if there aren't any limits, then they'll go to the nth degree, and they're in it until they can finish making a buck. They will destroy the industry, because there will be people who die from poorly formulated, adulterated, artificially enhanced products, all to make a buck to sell. That's the worst situation we could be in. And the same way that the dietary supplement industry needed regulation and became a $100 billion industry in America is because we had good regulations around it. And that's what we need to do with kratom.
Perfect. Thank you, Mac. I'm not seeing any others. John did ask, and we've covered this, but it might be a good spot to start to end here. How long will the congressional bill take to get passed? Are you all planning lobby days, and do you want constituents to get co-sponsors?
So the program that we're putting, this advocacy program that I referenced at the start of this webinar, is designed to do exactly that. You will make calls to your congressional delegation, go through the training so you understand how you should do that, and encourage them to become co-sponsors. And that's how we will add co-sponsors to this legislation. And I think the next step then will be for us, we're going to have a congressional staff day where we will have the experts make a presentation to the members' offices so that they can understand and answer any questions that they have. This is the way legislation moves. And we're going to be very aggressive in educating members of Congress about the importance of this. We wouldn't have 11 states that have passed the Kratom Consumer Protection Act, but for the science that clearly pushes. And we have not seen a state that has banned kratom since 2017, which was Rhode Island, the last state to succumb to the FDA's nonsense. I almost called it something worse, the nonsense that they peddle. And now the Speaker of the House in Rhode Island has said 2024 is going to be the year of Kratom, where they lift that ban and they replace it with the Kratom Consumer Protection Act, because the people of Rhode Island will be able to have access to a responsibly regulated Kratom marketplace. That's our goal. So I think that as we evaluate what the options are, this legislation is truly the best way to provide a safety profile and regulations to ensure the safety of Kratom products, properly labeled, properly manufactured. Without it, we're dead, because it'll just be unregulated, adulterated products that'll be thrown into the marketplace, all driven by a buck. They're as bad as the trial attorneys, meaning these Kratom manufacturers that don't care about the standards, and they just want a completely unregulated marketplace. They'll always find someone to want to buy their adulterated crap, and it'll destroy it for everyone along the way. And I see that the comment Misty made, or the question, that the Kratom Danger Awareness Group says that the AK's ultimate goal is to make Kratom a prescription medication. That's nonsense. Look, I get the pain that the people at the KDA have, and I think the majority of the people who have had experiences where a loved one has died and they have yet not seen the actual proof about what caused that death and want to blame Kratom for the economic incentive. But there are leaders in the KDA that go too far. I condemned, and I don't do it lightly, I condemned the behavior of some of the Kratom advocates that actually threatened public officials in a jurisdiction that was considering a ban on Kratom. I condemn that. But I didn't hear anyone in the KDA condemn the fact that people were calling me personally a murderer from the KDA group, just because I advocate for safe, well-regulated Kratom products. So the people that lead the KDA are not these great saints that they pretend to be, and they're acting irresponsibly. And I think that at some point we're all going to have to sit down and figure out how we can develop a consensus where we protect people, because that's our goal. Do I want, and does the American Kratom Association want to have Kratom as a prescription medication? No. Authoritatively, I tell you no. I want Americans to have access to Kratom for what it is, which is a botanical supplement, and I want the FDA out of this business. Now, do I want to restrict a company that wants to go through the multi-billion-dollar 10-year process to produce a Kratom product that is chemically reformulated and synthesized? I can't say no to that. I don't encourage it. I think it's ridiculous. And by the way, I don't think there's much of a marketplace as long as Kratom is available in its natural form and delivers the same effects. Now, obviously, a highly concentrated Kratom product might have some use in some circumstances, but there's got to be a payoff, and the payoff would be a marketplace. And if you're going to put the kind of billions of dollars into the development of a new drug that's based on Kratom's alkaloids, I don't know. That doesn't make any sense to me, and I'm not advocating for it. But it illustrates the lie that the Kratom Danger Awareness leaders, and I emphasize leaders because most people are in that group are well-intentioned people that have suffered great losses, and I understand it. But these people that are leading it, that are being fed misinformation and propaganda from their trial attorneys, and that's who's saying this, that's who's funding it, that's who's giving them their talking points, and they're wrong. They're absolutely wrong. So for anyone to suggest that the AKA is trying to promote a prescription medication, they're wrong. I had one of the trial attorneys accuse me personally in a hallway of a legislature, saying that I had imported Kratom and that I was making money off of Kratom importation. That's not true. I've never purchased any Kratom to export from Indonesia into the United States, never. And yet he said it with such ferocity and with such conviction, like it was true. And I'm sure he peddles that same nonsense to the KDA people, saying, oh, well, that's what the AK is about. They're wrong about the AKA. And there's nothing I'm going to say that's going to persuade them. I'll let the facts persuade them. And what our consistent advocacy message is, which is to get people to support regulations around Kratom. Because if we do that, and if we have Kratom products that are properly manufactured, properly labeled, and people are consuming them safely, I don't see much of a marketplace for a prescription medication based on a synthesized Kratom chemically formulated product. Did I mention that they're wrong? Did I mention they're not telling the truth? Did I mention that this is just nonsense, that the trial attorneys, they're the puppeteers that are getting the leaders of the KDA to say things that are just so goofy that doesn't make any sense? And again, I respect the majority of those people that feel that they were harmed, their families were harmed, but being led down the primrose path like the Pied Piper with this nonsense is just untrue. Doesn't make any sense to me.
Thank you, Mac. And should we rally after the bill is introduced, everyone in Washington, all the Kratom advocates?
So that's the purpose of our training for Kratom advocates. And we want as many people to join as possible, where we want to show you the pathway to make the connection with your congressional delegation so that you can tell your story and encourage members of Congress based on your experience, and then turn them over to us so that we can provide the policy and the scientific documentation that supports the passage of this bill. We will be successful with this bill if we get that kind of support. So this is a coordinated effort, and we're going to continue to work hard to make sure that we get the federal bill passed, just as we have done in the states where, 5 years ago, everybody said that's impossible. You can't get the states to do this. And yet, where are we? 11 states, and we're on the verge of getting 2 or 3 more this year. And we're looking at next year doubling it. I think that we've got a great platform that we're working from, and we're having great success. And not to mention, by the way, Vermont removed their ban on Kratom. There are only 5 states that have bans right now. Vermont did it on a petition from the American Kratom Association. It didn't come by listening to social media rants of some of the people in our community that keep saying we shouldn't have bans on Kratom. The Vermont legislature is going to follow now that removal of Kratom from the controlled drug list, and they're going to evaluate the Kratom Consumer Protection Act starting in January. I hear our enemies within say, oh, we don't need these regulations, and that's the worst environment possible. But we only have 5 states, and remember, in the 5 states that are left, Wisconsin is ready to start moving legislation this year on the KCPA to remove the ban. In Indiana, we had a passage of 53-40 in the House. It went to the Senate. The Senate wants an evaluation by the state health department. So we're allowing that, cooperating with it, facilitating it, and we're giving them information. State of Arkansas doing the same thing. They have an interim study bill that was unanimously approved for study by the committee that will remove the ban and implement the KCPA. Everyone should read that bill. It's a great bill because its findings validate the very thing that we're doing. And we know that in Rhode Island, I told you that Speaker Shekarchi said 2024 is the year of Kratom. So we're going to eliminate some of these bans and that were done by the lies that the FDA told these states that they should ban Kratom based on the federal ban that was coming. All of those states did that on the promise of the FDA that they were going to get a federal ban. And where are we today? No federal ban, no international ban, despite the FDA's trying to get it. And what we have is a conflict between the FDA's bogus propaganda and the scientific truth. And we're on the side of the scientific truth. So that's why we're winning in these states, and we're going to continue to do so.
Thank you. And looks like our last question, what adulterants should we be testing for?
So this is a great question because we're now learning more about what I'll call the Kratom method to test to see what adulterants are in it. Chris McCurdy at the University of Florida, the leading contract scientist for NIDA, has properly stated that there are many yet to be identified novel psychoactive substances that are implicated in a lot of these evaluations by medical examiners, and they haven't been tested or identified yet. So there's going to be a catch-up period. And this is true for everything, by the way, not just Kratom. There are substances out there that just haven't been identified that can be put on a drug screen. But we know that a drug screen should include the obvious culprits that are easy for adulteration. Fentanyl. Absolutely, every death should be tested for the presence of fentanyl. When you look at the Centers for Disease Control report that they did in 2019, evaluating reports from medical examiners of so-called Kratom-associated deaths, and they found that I think the number was like 68% of them had fentanyl in them. And then you combine that with the testimony of the doctor in Ohio who testified that her son died of a Kratom overdose, and when they tested it, they found it was fentanyl. Her son was a student at American University in Washington, D.C. He and his friends would routinely buy Kratom to help them with all-night study sessions increasing their focus. Her son went out and purchased Kratom on a street corner, and it was laced with fentanyl that killed him. That's why we need the Kratom Consumer Protection Act, and the testing for that panel of of controlled substances is important, because the CDC report referenced cocaine, morphine, heroin, and fentanyl. And then, of course, you get into buprenorphine and other prescription drugs that obviously are at levels that are taken improperly will kill you anyway. So we need to test for that to determine what the adulterant is, or the co-use of it, which is obviously a separate problem that we need to address in terms of educating consumers.
Thank you, Mac. And I'm not seeing any more questions. Do you want to have any closing comments?
Let me tell you that I say it all the time, how much I appreciate the advocacy community. I try to kind of swoop in and watch the social media discussions that go on. I have this crazy travel schedule, so I'm not very diligent, or I'm not able to be very diligent about it, but I try to participate. But I watch and I hear the passion, and I see the well-intentioned efforts that most people have. I see the community rise up and actually rebuke those few in our community that are the enemy of the good. And I appreciate that deeply, because this is a battle that we're all fighting together, and we should be as unified as possible. And I'm very grateful for this community. No one was more surprised than me in 2016, after I had advised the leadership of the American Kratom Association that it wasn't possible to get the DEA to withdraw the scheduling recommendation that had been published on August 31st of 2016. And I said that because there never had been a withdrawal. Once published in the Federal Register News, that's it. And yet 45 days later, in fact, the anniversary is coming up this Friday, October 13th of 2016 was the official withdrawal by the Drug Enforcement Administration of the Kratom ban that was proposed by the FDA. And interestingly, I hear it characterized repeatedly, not only by the KDA, but some of the people that are advocates within the addiction recovery community, as saying, oh, they dismiss what happened by saying, oh, it was all these crazy advocates for Kratom that changed that decision. Actually, it was more than that, much more. You had the 51 members of Congress and the 13 members of the Senate, and you had, as evidenced by the comments that were submitted in the open comment period, the DEA invited comments between October 13th and December 1st, 23,232 comments. A vast number of those were from medical professionals, law enforcement officials, and scientists. And you cannot discount the 8-factor analysis that was presented by Dr. Jack Henningfield, which added to the discussion and informed policymakers about how the FDA had failed to meet its burden to prove under the 8-factor analysis that Kratom was actually scheduled. So for those that dismiss the Kratom, the decision by the DEA back in 2016, because it was just a bunch of outcry by advocates, it was much, much more than that. And to that, I credit the Kratom community. And one thing is true, we've had advocacy fatigue, and we need to throw that aside now. We need to rally the Kratom community, because we know that the KDA is a well-funded, trial attorney funded operation. And we are funded by our advocates. And we're going to continue this fight, and we need to step up, and we need to rally just like we did in 2016. And I'll tell you that the scientific community is rallying to find the truth. And the results of peer-reviewed published literature are phenomenal. I'm not talking about case reports, and I'm not talking about commentaries by addiction recovery groups that complain about Kratom because they have a financial interest in it. I'm talking about objective scientific reviews of the safety profile of Kratom. And that's what should guide this policy discussion. At the end of the day, there will be a safer Kratom marketplace as a result of our efforts that we collectively promote to the US Congress. And we're going to eliminate the possibility that there will be deaths that will be associated with adulterated Kratom products. We will reduce that potential significantly by the passage of the Kratom Consumer Protection Act. And the vast majority of the Kratom danger awareness people should be grateful that we're doing that. And I can tell you there won't be many people left in that group when we're able to pass a bill that will properly regulate and restrain the marketplace in terms of those adulterated products and compel the FDA to finally do their job, because the FDA is not doing it today. If anybody's looking to who has blood on their hands, it's the FDA for failing to regulate this marketplace. The product that was ingested by the woman in Florida, for which there was an $11.5 million judgment because it was uncontested. And again, we don't know what really caused her death, but we know for a fact that the product that was marketed never should have been on the market. The FDA should have taken it off the market. And we've provided them with documentation on over 70 other products, and they sit on their hands and do nothing. And they are the ones responsible for any kratom death that is associated with an adulterated kratom product that's spiked with some other substance that caused that death. And they're getting away with it right now. That's going to come to an end with the passage of this legislation. So I think we're on the side of the angels, and we're going to continue to work. And I don't care what names they call me. We're going to continue this effort that is going to deliver to the American people a much safer condition under which people that are using this botanical supplement safely and responsibly in order to save their lives or improve the quality of their life. And I'm grateful to every one of you that are joining us in that effort.
Thank you, Mac, and thank you all for your time this evening. We will be in touch over the next couple of days with invitations to our advocacy training, next rounds for that, which is tentative for Wednesday, Thursday, and Friday, but we will be in touch over the next couple of days again with that. And with that, I'm not seeing any other questions, and have a great evening. Thank you all.
Thanks.